Private sector chiropractic. The professional landscape is changing for chiropractors. Opportunities based on practitioner specialty focused emerged first, including orthopedics, pediatrics, nutrition, rehab, and sports. The sports focus was certainly one of the first high-profile specialty roles given the involvement with major sports teams and the Olympics. Next were opportunities in the military healthcare system, both in the Department of Defense and Veterans Administration. Less available were emergency department and hospital involvement. Emerging in certain geographic areas is corporate chiropractic. Chiropractors are becoming increasingly involved in on-site and off-site clinics where chiropractic plays a major role in the management and prevention of musculoskeletal problems. All of these new diverse opportunities begs the question regarding chiropractic education and the need for a more broad approach, including training in the culture and technology of many of these new settings. To better gauge where we are with the breadth and degree of opportunity, several organizations and the present study we will review have attempted to survey the profession to see who is involved, where, and to what degree we are integrated. In an NBC survey on where chiropractors practice, the Practice Analysis of Chiropractic reported that 9% of DCs practice in settings other than chiropractic offices, including 7.8% who work in an integrated healthcare facility, with 3.6% stating that they hold hospital staff privileges. And in a survey of American Chiropractic Association members, 17% of 1,142 members reported working in an integrated setting. Of those 17%, 60% worked for private groups, 16% worked in outpatient and ambulatory care, 13% worked in hospital or medical centers, and the other 11% worked in other environments. Although largely positive, many DCs reported still facing barriers to full participation in the healthcare team, which included not documenting care in the same clinical record or a lack of referral from some medical providers. We know that other than private practice, public sector DCs who work in an integrated setting primarily work in the VA and DoD environment. But what about the private sector? A new study surveys a select group to find out specific practice characteristics. The title of the current publication is Integration of Doctors of Chiropractic into Private Sector Healthcare Facilities in the United States, a Descriptive Survey, published in the Journal of Manipulative and Physiological Therapeutics in 2017. The purpose of this study was to describe the demographic, facility, and practice characteristics of select DCs working in private sector healthcare settings in the U.S. The investigators selected 50 representative DCs known to them as practicing in an integrated setting. They further divided selection based on 4 regions of the U.S., North, South, East, and West, to obtain a broad representative sample. The selected DCs received an email invitation that included a project overview, informed consent statement, and link to the survey that was hosted on SurveyMonkey. So what did they survey? A 36-item close-ended questionnaire included survey of their background demographics, facility characteristics, chiropractic practices, and interdisciplinary practice involvement. Facility characteristics included the type of facility, departmental affiliations, and funding structures. They also asked about the following. In the chiropractic practice portion, workload, patient chief complaints, administrative reporting structures, financial compensation, which we will look at in a moment, and non-clinical duties. Interdisciplinary practice questions surveyed information on referral sources, use of electronic medical records, and delivery of spinal manipulation by other providers, among other items. In answer to the question of which type of practice setting, 40% were involved in a hospital setting, 21% in a multi-specialty setting, and 16% in a primary care ambulatory care setting. There were interesting findings with regard to interprofessional relationships. More than 60% of responders reported co-management or a team-based approach to care for their patients. Most respondents worked in the same clinic as the medical physician. Physicians were the provider types most often referring to the DCs in these settings, although advanced practice nurses and physician's assistants were often mentioned. The DC was the sole provider of spinal manipulative therapy only in 43% of cases. 57% of the time, spinal manipulation was performed by doctors of osteopathy, physical therapists, and sometimes medical doctors. Interprofessional communication patterns between DCs and other healthcare providers included informal conversations and shared electronic health records 73% of the time, telephone calls and formal referral letters 49% of the time, and formal team meetings or conferences 32% of the time. Remember that part of this survey was salary. The researchers took this data and created comparisons. These are interesting. The median annual salary reported by respondents in this survey was $112,500. In 2016, median pay projections of the U.S. Department of Labor Bureau of Labor Statistics was only $67,520. However, remember this is based on data from DCs being paid as an employee of a practice. In 2015, the VA average annual salary was reported as $97,860. Certainly, it is important to note that the select group of practitioners in this study likely had a practice history of many years, and perhaps many years in the integrative setting, which would equate to higher salaries than someone entering the system. As stated at the beginning of this presentation, this increase in involvement and diversity of involvement, taken together with involvement in the DoD and VA, are worth learning from. Those currently involved in these positions likely evolved into and helped develop their roles in their respective settings. Those who follow could benefit from a comprehensive review of the attitudes, skills, and knowledge necessary to be successful in these environments. There are really two ways of taking that information and creating a training approach. One is as part of the core of chiropractic education, or the second, which is a certification type approach post-grad, or perhaps a hybrid of the two. Hopefully, as we see more and more diversity in the professional opportunities available to chiropractors, we will also see an expanded approach to providing both the pathways to opportunities and the training to help better prepare individuals for these new environments.